So, good morning, everybody, to the first of our podcasts for Dementia Action Week. And we are delighted today to have Neil Cutler with us. So, Neil Cutler, if I just do a quick introduction, is a trustee at Dementia Forward, and he is a retired senior manager who worked in the NHS for 33 years. And Neil is also the Equality, Inclusion and Diversity Trustee for the charity, after Dementia Forward provided excellent support during Neil's partner's last years of living with dementia. So Neil does lots of stuff, and he facilitates talks to all sections of healthcare on the effects of dementia in the older LGBTQ community. So welcome here today, Neil, for our 3 questions for Dementia Action Week. And I
Thank
really
you,
hope
Fiona.
that you are managing to enjoy the sunshine.
Yes, I should be out sizzling anytime.
Great. So the 3 questions that we would like to ask you today, I'm just going to start with question 1. And it's quite a broad question, and it's a one that I know that you resonate with quite a lot because there was a lot going on back there. But just tell us what it was like as a gay man in a gay relationship back in the 1960s and 70s, the 1960s and 70s, and just how did it shape your relationship with John, who was your civil partner?
I will try my best. I'm glad you said 1960s and 70s. It would have been more awkward if it was 1860s and 70s. Yes. So what a lot of people don't understand, and I'm only too well aware of that would be the case because it wouldn't be on their spectrum, if you like, is that the Sexual Offences Act didn't come into being until 1967, which decriminalised homosexuality, but only for same-sex couples aged over 21, and any activity had to be in private, being in a guest house or a hotel, or even in staff accommodation in a hospital wasn't classed as private. So the idea of actually having a fulfilling relationship with a same-sex partner was just not on. And it was a number of years before things got better. John and I got together in 1974 when life was still very difficult. And John was 9 years older than me. So therefore, his travel through the early years of his life was even more difficult because, unfortunately, he'd been caught in a compromising situation in the late 1960s, early 70s in Cardiff, was taken to court and was found guilty and fined, which really clouded his future, and his family were not very accepting of him. So yes, it was very difficult for people getting together in the 60s and 70s. We still suffered some abuse when we got together in 74, and that persisted way through the 70s and through the 80s. And then, of course, in the 80s, along came the AIDS crisis, which really classed everybody as being gay, as either a paedophile or a deviant or something horrible, which was even worse. And then, of course, it wasn't until 1990 that the World Health Organization, at long last, declassified being gay as mental illness. So at one time, not only were we mad, we were also bad. So, yes, it was very difficult. As I said, John being that much older, he built this sort of little closet round himself. He always maintained that his name was Jeff, not John. He always maintained that he'd been married and had a daughter. He was Jewish. Oh, there was a whole load of things. But he couldn't keep the pretense up. And after about 15 years, unfortunately, had a really bad nervous breakdown, and all the truth came out, which unfortunately changed him rather badly. But by that time, we'd invested a lot into the relationship, and he just thought, well, we'll make this work. So we did. I don't regret any of it. And those first 15 years were really quite good. We were better if we were away on holiday, because then we weren't in our own environment. We were in a different environment, which was so much easier. But yes, it was really difficult in those days. Yeah.
Yeah. I mean, we talk about dementia and how we need to know the history of the person in order to provide like really good support. And, you know, from what you've just said there, it's like John's had to hide quite a lot of who he actually was, even when he didn't have dementia, in order to feel like he had to fit in with society. So you know, I can just imagine that that was really difficult when John actually did get dementia. What was the impact when he actually did start to go down with his Alzheimer's?
Well, it was difficult to determine when it started, because he'd always been clever at covering up our relationship way back at the beginning. I mean, the other thing I forgot to mention was he always maintained we were cousins. We were never partners, and even towards the end, we were always cousins. Um, Trying to create that sort of screen around himself. So it was difficult to determine when he started to have memory problems. I'd rather call it memory problems at this stage rather than dementia. Um, and he used to spend hours on his mobile phone trying to make it work. He couldn't understand the workings of it. We bought him a laptop because I'd got a desktop when I retired from the NHS, but he would never do anything. You'll have to show me how to use it. I said, well, like all computers, the only way to find out how to use it is to use it, because you only make mistakes once. You soon learn. But he wouldn't do that, and we really got to a really difficult point. As I say, I retired in 2002, and we moved to North Yorkshire. And by the time we got to about 2013, 2014, his memory was really bad. I'd say to him, oh, we're doing so and so tomorrow. Is that okay? Oh, yeah, that'd be lovely. So you get up in the morning, you got up early. I said, well, yeah, we're going to go into so-and-so today. Oh, are we? I said, oh, yes, don't you remember? Oh, I've been to bed since then. That was always his stock phrase. Oh, I've been to bed since then. So, yes, it was really difficult to determine when things got really bad, but we got to a point where things were really, really difficult. And I said to him, I think we need to go and see the GP. I'm sure it's something simple. We can sort it out. Well, you make the appointment and come with me. I said, yeah, it's fine. It's not a problem. So we went. And the GP said, I don't want you in here while I do this little test. Would you go in the waiting room? So I said, yeah. And then she came out to get me and she said, we have a problem. So by that time, yes, things were really bad. He was asked to draw a clock and put the times on it, the numerals on it, and put hands at a certain time. And it was just all down one side. He just couldn't fathom it one bit.
Yeah.
So we referred to memory service at Knaresborough, and they did the necessary tests. They parted us when we got to the clinic. They wanted to talk to us individually. And then the consultant wanted a brain scan, which happened very quickly. And that determined that he had, by that time, got medium-term dementia. And I think once he understood that, he gave in. He just didn't fight it anymore. And that's when life became really, really difficult. And what I think people don't realise is that dementia's not 9 till 5, it's 24/7. It never stops. Just when you think you've got a moment to yourself, a voice calls, I need so-and-so, or I need this. And you just think, oh, please give me 5 minutes. Yeah, no, it's really difficult.
So emotionally, I know that you said that you had problems with friends, and also when John needed to move into respite and full-time care, that was an issue as well.
Yeah, yes. I think most of our friends, our friends knew what the situation was. I mean, they weren't that daft. We're talking 2012, 13 by then. The world had moved to a very different place. So yes, but they sort of kept their distance because he'd seen them all off. He didn't want them to come. We used to have people round for dinners. We used to do our candlelit suppers, as we used to call them, very much keeping up appearances. And he always used to maintain that they'd stolen the tea towels, they've stolen the toilet rolls. We're not doing that ever again. So we went for a while where we didn't invite anybody around, which was not really very good. And then he then went into hospital. It was about this time, 10 years ago, that he started on his journey into hospital. And we had to put it in such a way that it was part of his journey to get better. Because he was in a really bad state. And we just made the point that the tablets weren't working that he was on. There was some real difficulties with those. We needed to pop him into hospital so they could monitor the situation and try and rearrange his medication. And that was really how we got him to go to hospital, because he was an obstinate so-and-so at times. So yes, so we went now 3 weeks in what was then the mental health unit at Harrogate Hospital, the Briery Wing. Came home for 12 weeks, which was a seemed more like 12 years. And then he went back in again, and he was got to the point where he'd have been sectioned under Section 3. So we had to find a care home for him. It did cause a few problems. But there again, you see, when he was in the nursing home, I used to help afternoon teas because the staff, some had gone off for lunch. And it was only just a case of serving cups of tea to people. And they got more than one day room, which I thought was nice. They were always in a different day room every day. And he was in the small day room this day, along with another couple, husband and wife. The husband was living with dementia. And I gave them their tea, and then I gave John, and I came and sat there. And she turned around, she said to me, "How do you know John?" I said, "Oh, we're civil partners. We've been together 40 years. "Oh, that's nice," she said. Turned around, never spoke to us ever again. So you still got that anti-feeling from people of our own age that still haven't come to terms with the fact that the world's moved on. They're still stuck in that thing. And it's very difficult. And it's very difficult for those that chose to go down the straight route or were forced down the straight route as youngsters because they had to bring up a family. They needed to manage the family business, no matter what that was. You need a family. So, of course, when dementia sets in, it puts them back to those awkward times when they were coming to terms with their sexuality. And we know of cases where men in particular have been in a care home and the staff have said, "Oh, your wife's here to see you." "What wife? I haven't got a wife." And that's because they're back at the time when they didn't want a wife, they didn't want children. And so, yes, it's really very difficult.
Yeah. And I know that you're working with the LGBTQ community now in order to raise awareness of problems that are being highlighted when people are kind of going into care now, because it seems to be sort of now that we're seeing sort of quite a lot of issues. So because you've got all of that experience, and because probably it's not spoken about very much, I know that in Dementia Forward, kind of, we didn't know this whole side of kind of problems in dementia until you came along and said, "Hey, look at this." So just tell us, Neil, because you're doing so much now and we are so grateful for what you're doing. Just tell us what you're doing really now to highlight the problems that you're seeing in the LGBT community now when there's a dementia or a cognitive issue that takes a hold and people have to move into different environments, like, for example, care, etc.
Yes, no, it is really difficult for members of the LGBT community. I know other people like myself that have gone down that route, but they won't talk about it because they're still not that open about it, because they're coming from that time when it wasn't good to be open and talk about things, and they've lived that life. Yes, they've lived in long-term relationships, but they've always managed it like John always managed it. "Oh, we're cousins." And we always had to make sure we had a place that had 2 bedrooms. And we always kept 2 bedrooms dressed so that if anybody came round, "Oh, this is my room. Oh, this is my room." That was a load of baloney anyway, but there you go. But yes, there are people that do that. But yes, I just felt after what I'd experienced and realised where it had put John, etc., I just thought we need to talk about this. The LGBT community are 10% of the population, regardless of what the census says, and most probably even more so because there are lots of people that live alone that are members of the LGBT community, but don't want to tell people that. They sort of keep that to themselves. I respect that. They don't have to come out. I mean, that's the other thing. Why do we have to come out, for crying out loud? Why don't we turn it around the other way and make the straights come out and just let being gay acceptable? That would be a change, wouldn't it? So it's important that we just wake up and realise that there is a big chunk of people who are now in the time of their life when they are likely to develop dementia. They would have had difficult lifestyles. They would have most probably drunk to excess in certain times. We all smoked like chimneys in those days, which is a real downer for dementia. So we're getting to that point in life where it's becoming really difficult for a lot of people. So I now do a whole range of things. It wasn't meant to be. It was just meant to be a little talk to get things underway. It started with me doing work with Home Instead in Harrogate. It then mushroomed. I shared what I was doing with Debbie because she'd supported John and I. She'd been around during our associations with Dementia Forward when John was alive, and shared it. And she said, "Oh, this is good. You ought to do more with this." I then got invited to Manchester because they were doing a program called Bring Dementia Out. and I was invited over there to do a lifestyle talk. So I did that. They then put me in touch with a chap called Claudio De Laurito, who was a research psychologist in those days at Nottingham University. And we started to do a whole load of work, and we still do. We do even more these days. And we did all that stuff online. We've never met in person until this year. And we met in person in January this year, where he and I and two other members of our team did a presentation to a dementia conference at Manchester University. It was a 3-day conference. We did that. And then subsequently I've been up to London, met Claudio, he lives in Lambeth, and we went and did a presentation to medical students at the Royal Free Hospital in Hampstead, which was really interesting. But I also do the basic dementia awareness training for Lister House, the British Legion care home in Ripon. I was a trustee of the York LGBT Forum for a while, and we do a programme called Free to Be Me in Care, which is a 2-hour presentation consisting of a lesbian couple, a trans person, and myself. We talk about all the various bits about what we require for healthcare. We want to feel we're in a safe space. We want to be able to recognise signs and symbols that mean something to us as a member of the LGBT community, be it a pride pin or a pride flag or pride lanyards, somewhere that it makes us know that we're in a safe space. Because unfortunately, quite a large proportion of us live alone, have no family. Quite a lot of, especially the trans community, have been annexed from their family, and they will struggle with poor mental health. And they are going to be a really difficult one in years to come if they develop dementia, because one day they're in their transition state, another day, then they're in their pre-transition state. So for care staff, it's a case in the morning, so where are we today? And it's not easy to ask, and it's not easy to ask questions, but when people do go for care, if they feel they're in a safe space, there is no reason why you shouldn't say to them, do you identify as a member of the LGBT community? How do you wish to be addressed? What are your pronouns? It's not rocket science. It just makes people feel comfortable. They might say, well, I don't recognise at all. Okay, sorry, I didn't mean to offend you. I just need to ask the question, because we need to make sure that your care is all inclusive and we respect how you wish to be treated. And it's the same about having same-sex photos and things in your room at a care home, things that you feel comfortable with and that you can share with the staff. You don't have to share with the other residents at the care home, but something that brings and means something to you. So so I do a whole range of things. I'm off on the 2nd of July up to London again. We're doing a presentation which Claudia and a whole team of us have been working on. It's called Unequal Lives, Unequal Opportunity. It's a grand challenge being funded by University College London. It's a 10 till 3 presentation. 5 of us have done our life stories in pictorial form, and we're going to be talking about that at this presentation and the whole range of work that we're doing. We've invited lots of people to come, and we've said to the people that come, if you're doing something for another organisation that's dementia related to the LGBT community, bring along your paperwork and stuff, and let's share it at that event, because there's no point in all of us trying to reinvent the wheel. We need to work together to make sure that we've got a really good package of care for everybody, and it's no point in one doing something different.
Neil Cutler, you are an absolute marvel, and I'll tell you why. Because until you came along to the charity, we kind of put ourselves out as being, we're inclusive, we're open to absolutely everybody. But you pointed out that it's more than kind of just saying that. You have to demonstrate that. And I suppose for people listening to this podcast, you know, that reaching out is really important. I think a lot of us are very scared about kind of starting off a conversation in case we insult. You know, sometimes we just don't want to kind of say the wrong thing and for it to be taken the wrong way. But I suppose what you're saying is, if we have the symbols out there, if we're open to have very honest conversations, if we see a photograph in a room of 2 members of the same sex together, that we're not sort of a bit scared of saying, oh, is this your husband? Is this your wife? And just waiting to see kind of what the answer is back. It allows people to know that we're in a space where you can talk about this stuff rather than it be hidden. You know, you said that John spent almost all of his life hiding truly who he was. And we absolutely need to turn that on its head. Don't you agree?
Yes. Yeah, I quite agree. And especially in the last years of your life, you want to be able to be yourself, be comfortable, and enjoy those last few years. What's the point of carrying on hiding? You've
Absolutely.
done it all your life. No, just
Absolutely.
forget it. Go and do your thing. And that's what I'm doing. I'm just going doing my thing.
Yeah, but you're not only just doing your thing for you, Neil, you're doing your thing for everybody who can't speak out the way that you are. So
Yes. Yeah.
I just want to say thank you from a charity perspective because you've helped us on our journey into
Thank
seeing
you.
all of this. And I suppose on behalf of lots of people who you're speaking out on behalf of who haven't got the courage or the want to do what you're doing. I just want to say thank you so much. And thank you for being involved in this podcast. It's been absolutely lovely talking to you. And it's always wonderful working with you, Neil. Thank you.
It's always wonderful working with you, Fiona.